Mr. President, I'm joining my colleagues today to speak in opposition to the Republicans' catastrophic budget bill that will end health care coverage for millions of American families so that President Trump can orchestrate the largest transfer of wealth from the poor and working class to the ultra-rich that we have ever seen in this country. This bill has nearly $1 trillion in health care cuts, including over $800 billion in Medicaid cuts. In total, the nonpartisan Congressional Budget Office estimates that this bill would not only add $2.4 trillion to our national deficit, but it also kicks 16 million Americans off of their health insurance in the next 10 years. In Nevada, that means about 95,271 people will lose their health care. 66,571 will be kicked off of Medicaid. These numbers alone should at least give my Republican colleagues pause, make them think about how devastating this bill would be for our working families, and maybe even reconsider moving forward with trying to ram it through Congress. But there's more to this than just these big numbers, and it needs to be brought to light. I was just home in Nevada meeting with Nevadans, hospitals, providers. With the Medicaid cuts they're anticipating from this billionaire tax giveaway, hospitals are bracing themselves not just for coverage losses, but for the downstream impact on care and costs. This is going to affect our most vulnerable populations in Nevada: seniors, children, veterans, parents of children with rare diseases, pregnant women, and our elderly in nursing homes. When people lose coverage, they delay their care. A single mom who's living paycheck to paycheck and is worried about putting food on the table for her kids is not going to go to the doctor if she has a persistent cough. She will wait. But that means that when her cough turns serious, making it harder for her to breathe, she'll have to go to the emergency room for treatment. By then, it's more dangerous for her and more expensive for everyone involved. The hospital she goes to has to treat her, regardless of whether or not she has health insurance. If she can't pay, the hospital is on the hook for the cost of her care. Now, if you are in a rural or underserved area, of which we have many in Nevada and across the country, and the one hospital for miles can't afford to keep those doors open, it may scale back or close altogether. And the hospital staff have to choose which services to cut. Labor and delivery, mental health care, trauma units. These are services entire communities rely on. Or will they be forced to close entirely if they can't make up the costs? In rural Nevada, people sometimes have to drive 2 to 3, 4 hours to see their doctor. A hospital closure would be devastating for rural families trying to access even basic care. That's the danger we are facing with this bill. This isn't just about Medicaid patients. As providers look to cover the cost of treating more uninsured patients, those expenses will shift to everyone, to working families and to employers. Premiums and out-of-pocket costs will soar. Also, that this president and Republicans can pay for tax cuts for billionaires. You know, this is always also going to impact Nevadans who rely on the Affordable Care Act for their medical insurance. Republicans, in their bill, cuts almost $300 billion from the ACA marketplace plans. And that would kick about 29,000 Nevada small business owners, middle-class families, and legal immigrants like Dreamers off their health care. It would also increase Medicare premiums for over 1 million seniors, and it could end health care coverage for 1.5 million children. These are real people who are going to lose their coverage as a result of this bill. And this impact would be lasting. This bill is so expensive that it would force Congress to make even more Medicare cuts in the future. For those who don't immediately get kicked off their health insurance as a result of cuts to Medicaid, my Republican colleagues want to implement burdensome work reporting requirements so they can take away coverage from even more Americans to pay for those billionaire tax cuts. In Nevada, over 67% of Medicaid recipients, they're already working. But if this bill passes, those working families will have to jump through even more government reporting hoops to prove that they work. We know this from states that have tried this, like Arkansas, that people lost Medicaid not because they didn't meet the requirement, but because they couldn't keep up with the red tape. Think about this. People working who already have access to Medicaid, they're making it harder for them to get it, which means that then if you lose your Medicaid and your insurance, there's a possibility that because if your health gets worse, you're going to lose your job. We're going backwards. This bill adds complex paperwork, frequent deadlines, and little flexibility to the everyday lives of hardworking mothers, veterans, and families across the country. And why, again? Because the Republicans' goal is to take Medicaid away from as many people as possible so that they can find revenue to pay for the tax cuts for billionaires. Think about what I said at the beginning. It's the biggest shift in our country of wealth from the poor and the working class to the billionaire class. Instead of making the billionaires pay for this, they're taking it off the backs of the very people that are working in this country in the middle class. And they're preventing from the poor from getting into the middle class, and they're making it harder for the middle class. This is absolutely absurd. It is un-American, and we cannot accept this as our new normal. So, my Democratic colleagues and I are going to continue to stand against this outrageous and dangerous bill because we know that the American public deserves better. Americans deserve a Congress that is helping to lift the poor into the middle class and helping the middle class have their lives a little bit easier. And if we're talking about who should pay their fair share, well, I can guarantee you if we polled Americans, they would say it was the billionaire class. A billionaire class should pay their fair share and not make it harder. Not make it harder for the poor and the working class just to get by and just to get through the day. With that, Mr. President, I yield the floor.